Chapter 3. What makes a great home health nurse? If you are considering a career in home health care, here are some things to keep in mind: flexibility, organization, and relationship building skills. Here are some of the skills you'll need to be a successful home health nurse. These qualities will not only make you a great nurse, but they will help you get the job done. These are just a few of the many qualities that make a home health nurse great. Skills needed. There are several skills you should have as a home health nurse. This job requires you to be able to communicate effectively. You will be expected to convey information to patients in a clear, concise manner and to develop trust with patients and their families. Likewise, you will need to be able to switch between layman and medical jargon when interacting with patients. These skills can help you enhance your relationship with patients and foster better care. Physical stamina, flexibility, and a high level of mental strength are required to work as a home health nurse. Depending on the type of patients you see, you may be required to perform regular physical tasks. You should be compassionate and sensitive to the emotions of patients and families. You should be organized, detail-oriented, and able to handle multiple tasks at once. The job also requires a high degree of physical stamina, especially when dealing with patients who are ill or in pain. As a home health nurse, you will be interacting one-on-one with patients, enabling you to develop a stronger connection with them. Home health nurses also have the advantage of working in a much more personal setting compared to a hospital or medical office. For this reason, many home health nurses choose to work part-time or even full-time, allowing them to earn a higher income while working at home. As a home health nurse, you will be responsible for providing skilled nursing care in patients' homes. In addition to providing care, your role also involves assisting the family with self-care. Home health nurses also monitor the patient's physiological condition and safety. Throughout the job, you will be responsible for developing and implementing care plans, developing patient-centered care, and exchanging information with appropriate medical staff. Flexibility. What makes a good home health nurse? Flexibility. Home health nurses work with patients in their own homes and form strong relationships. They have plenty of autonomy and are generally motivated self-starters. The role requires good communication and organizational skills. A great home health nurse should be confident in her ability to perform her duties and assert her patients' needs. Flexibility in your work environment is essential for patient safety and satisfaction. Advanced communication skills. In home care nursing, nurses are often responsible for working with patients, often patients who do not speak English very well or are unable to understand basic instructions. They must be able to listen to patients and be flexible and responsive in unexpected situations. In addition to having excellent communication skills, home health nurses must be physically fit to withstand the demands of the job. As a result, they need to have an advanced understanding of human behavior. Flexible workplace. Flexible work schedules enable nurses to make the most of their time. Flexible working conditions can be created through creative thinking. Flexible working hours can be set up so that a nurse can fit work and home life. This type of schedule will be more complicated, but can be designed with input from other healthcare professionals. Flexibility also enhances the ability to develop a relationship with patients and the community. As a result, home health nurses are often better suited to help the elderly and other patients who are not able to leave their homes. Depending on the agency, a home health nurse can work traditional hours or flexible hours. Some home health nurses work overnight, while others work 4 days a week. The latter option can also be flexible, depending on the agency. A home health nurse can work weekends and holidays. This flexibility allows nurses to schedule their own personal appointments, as well as other activities throughout the day. A home health nurse must be able to make clinical decisions while working with patients. In this role, nurses must apply their assessment and teaching skills on a daily basis. Organization. Nurses are often faced with a variety of responsibilities, including delivering high-quality care. In home health care, nurses often must make decisions based on multiple factors including patient condition, engagement, and caregiver availability. A recent study reviewed the decision-making processes and strategies of 26 home health nurses at 3 agencies. Findings revealed that nurses develop personalized visit plans based on the needs of their patients, and then revise them as necessary based on patient condition, engagement, and availability. This study also identified strategies to improve visit planning to positively influence patient outcomes. Magnet-recognized organizations involve nurses in decision-making processes, ensuring that they work collaboratively with other disciplines. Nurses in magnet-recognized organizations demonstrate high-quality patient care and collaboration, as well as collaboration with other disciplines to provide integrated, coordinated care. They measure patient outcomes and develop strong partnerships with community organizations. They engage in evidence-based practice and use national benchmarks to measure outcomes. An effective home health nurse exhibits leadership skills. She can inspire the team by sharing a vision and fostering a collaborative environment. She can also be a great mentor, an educator, and she can encourage and inspire others to develop their own skills. She may even choose to earn a doctorate and further her education through certification. And because of her compassion and care, she is often the only one who can provide the best care in the home for a patient. In addition to patient-centered care, an effective home health nurse fosters a collaborative relationship with patients. The nurse also builds trust with patients by documenting the patterns of the visits. During the visit, she assesses patient eligibility and ensures that all patients receive appropriate care. If the patient is not engaged in their care, the nurse informs the patient and the physical therapist, and if necessary, reactivates the skilled nursing services. Relationship building skills. Good communication skills are an essential tool for a home health nurse. Effective communication skills help the nurse convey information to patients and foster trust. Good interpersonal skills can also help the nurse provide high-quality care. Active listening skills can be strengthened through reading books or taking online training resources. Active listening skills are essential in home health nursing, as they allow flexibility and adaptation to the work environment. Moreover, home health nurses need to be flexible and adaptable to patient needs and preferences. As a home health nurse, you will be working closely with patients. Your patient's health is a primary concern and your job is to make them feel comfortable. This means that you must learn to develop positive relationships with your patients. By asking questions and getting to know their personal lives, you can make them feel more comfortable and find the best treatments for their conditions. Relationship building skills are essential for the successful career in home health nursing. You should have excellent interpersonal skills, as these skills are essential for a successful career in home care. The ability to listen to patients and understand them, and expressing care and concern is essential. By developing relationships with your patients, you can improve their health and well-being. If you're passionate about your work, you'll be able to develop relationships that will last a lifetime. Relationship building skills make a great home health nurse, so develop them as much as you can and see if they will be your top priority. Good communication skills are essential for establishing rapport with patients. By developing trust, you'll be able to better understand their feelings and understand the needs and preferences of their patients. With the ability to communicate effectively with patients, rapport is a vital component for improving care. Rapport building skills are not universal, so you'll need to learn how to build rapport with each patient. You need to consider each patient's communication preferences and adapt your communication style to make it work best. Independence. As a home health nurse, you are part of a larger care team, but you must still have independence to carry out your job well. Home health nurses work in a setting that is not always conducive to a traditional setting, which requires an extra level of adaptability and critical thinking. You'll meet patients in their homes, which can be unnerving for a patient if they're not used to interacting with outside professionals. Luckily, the independence of working in a home-based setting makes it an ideal career for nurses. Working in a home-based setting allows nurses to gain experience by working directly with patients. The freedom of home-based care means nurses can take their time and learn more about patients' needs. They can also earn a bachelor's degree while working as a home health nurse. A home-based nursing job is rewarding for both the nurse and the patient. It's important to consider the pros and cons of the job before making a final decision. An independence-oriented home health nurse can choose to work a more traditional job or a more flexible schedule. Some nurses work overnight or on weekends, depending on the agency. You can choose your hours. Home health nurses can work 4 days a week or even on weekends. The work schedule is completely up to you, and you'll have more freedom to determine how much time you want to spend with your patient. Home health nurses must be compassionate, knowledgeable, and dependable.